All right, welcome to another deep dive. Today we're going to be tackling community health program planning in Canada.
Ooh, excellent.
We'll be drawing from chapters 9 and 10 of Stanhope and Lancaster's Community Health Nursing in Canada, the 4th edition textbook, to help guide our exploration.
A classic.
Yeah, definitely a classic. So whether you're a healthcare pro, a student, just someone who's interested in how communities tackle health issues, this should give you a solid foundation. Let's kick things off by defining what exactly we mean by community in this context.
Yeah, when you hear community, you might think just like your neighborhood or town, right?
Right, it's just like a geographic area.
But it's actually way broader than that. It's more about shared interests or connections, occupations, social standing, even health status, anything that kind of brings people together, really.
So it's less about the place and more about the people.
Exactly. Imagine a group of parents, right? They're concerned about the lack of safe places for their kids to play. They get together, advocate for change, work with the city to build a new park. That shared concern, that action, that's what defines them as a community.
That makes total sense. So it could be like a group of seniors advocating for better access to healthcare, or even an online community raising awareness about mental health.
Absolutely. And this actually leads us to a really important idea in community health. The concept of community as partner. You see, CHNs, or community health nurses, they don't just waltz in with solutions.
Right.
They work with the community.
More collaborative.
Recognizing its strengths and building on those.
I can see how that would be way more effective.
Oh, for sure. It's like way more sustainable, too.
Yeah.
Empowering communities to take charge of their own well-being, right?
Absolutely. But how do you actually go about building that trust and collaboration?
Well, it starts with listening, like really taking the time to understand the community's concerns, its values, its existing resources. It's about building those relationships, showing respect, and working together to find solutions that actually meet the community's needs.
I imagine that can be pretty challenging.
Oh, yeah, definitely. There can be hurdles. Some community members might have had negative experiences with healthcare systems in the past.
Yeah, that makes sense.
So building that trust is just absolutely crucial.
For sure.
And then there's also navigating tower dynamics, CHNs need to be really aware of their position and make sure that the community's voice is actually heard and valued in the decision-making process.
Right, because it can't be a top-down approach.
Exactly. It's got to be a genuine partnership.
That's a great point. So you need to be really mindful of those dynamics and make sure everyone feels empowered to contribute.
Totally. It's about creating a level playing field.
Right. For sure. This is really helpful in understanding how CHNs approach their work. But how do they actually think about community health itself? What does that even mean?
That's where the 3 dimensions of community health come in.
Okay, 3 dimensions.
The first one is status. Think of it as like a snapshot of the community's health, things like morbidity and mortality rates, life expectancy, risk factors, all that kind of stuff.
So it's like the hard data, the numbers.
Yeah, exactly.
Yeah.
And this data usually comes from sources like Statistics Canada, which gives you a pretty good picture of what's going on in a particular community.
Okay, so that's status. What about the other dimensions?
All right, so the next one is structure. This is all about the services and resources that are available in the community. Think hospitals, clinics, healthcare providers, but also things like housing, transportation, even the social and economic environment. Basically, it's the infrastructure that supports health.
So it's not just about healthcare, it's about all the factors that influence a person's well-being.
Exactly. It's about looking at the bigger picture.
That makes sense. What's the third dimension?
All right, so the third one is process, which is all about how well a community functions and solves problems. This is where that idea of community as partner really shines.
Can you give an example of what you mean by process?
Sure. Imagine a community with a really high rate of childhood asthma. They come together, they identify that the problem might be air pollution from a nearby factory, they organize, they advocate for change, and work with officials to implement stricter environmental regulations. That's process in action. It's the community working together to improve its own health.
So it's about identifying a problem, coming up with solutions, and then taking action.
Exactly. It's about empowerment.
I love that. So CHNs need to understand all 3 of these dimensions: status, structure, and process, to effectively address health challenges.
Oh, absolutely. You can't just focus on one. It's got to be all 3 working together.
Makes sense. Now, I'm curious about how these ideas actually translate into real-world action. How do you move from understanding the community to making a real difference?
That's where community health programs come in. In Canada, the Healthy Communities movement has been huge in promoting this approach. It's all about empowering communities to take ownership of their health and well-being.
Can you give me an example of what that looks like in practice?
Absolutely. A great example is the Homeless Partnering Strategy, or HPS. It's a government-funded program that works with communities across Canada to address homelessness.
Sure.
They use this housing first approach, which focuses on getting people off the streets and into stable housing while providing support to tackle the root causes of homelessness.
So it's not just a Band-Aid solution. They're trying to address the underlying issues.
Exactly. It's a great example of how government and communities can partner up to tackle complex social issues and improve those health outcomes.
This is all really fascinating. But I'm wondering, before you could even start planning a program, you need to really understand the community, right? How do CHNs go about assessing a community's health? What does that process look like?
That's where the community health assessment comes in. It's like gathering all the pieces of a puzzle before you can see the full picture. You need to collect all sorts of data, both the hard numbers and the qualitative information.
So it's a mix of statistics and stories, data and lived experiences.
Exactly. You might look at Statistics Canada data to understand demographics and health trends, but you also gotta talk to people in the community, conduct interviews, hold those focus groups, do surveys, get their perspective on the issues. Sometimes CHNs even do what's called a windshield survey.
Windshield survey?
Yeah, it's exactly what it sounds like. The CHN drives or walks through the community, observing the environment, housing conditions, green spaces, access to healthy food, the overall feel of the place. It helps get a feel for the community's character and identify potential issues that might not show up in those statistical reports.
That's a really interesting approach. So you're gathering all this information, then what?
Then comes the analysis. You got to sift through all that data and identify the key health concerns, understand the factors contributing to them, and this is super important. Recognize the community's strengths. What are the resources they have? Who are the people and organizations that can help create solutions?
So you're not just looking for problems, you're looking for potential too.
Yeah, exactly. Challenges and opportunities. But here's the thing. You can't tackle everything at once, right? So how do CHNs and communities decide which issues to prioritize?
That's a good question.
It comes down to working together. You got to decide which issues are most pressing. Think about severity, resources, and this is key, the community's motivation and willingness to address the problem.
So you're choosing your battles strategically, focusing on where you can make the biggest impact.
Exactly. And that leads us nicely into the next step, planning and implementing health programs.
Perfect. Let's talk about that. What does a health program actually look like?
Think of it as a roadmap for change. It outlines specific activities designed to address the chosen health concern with the goal of, making a positive impact on the community's well-being.
So it's not just a bunch of random ideas, it's a structured plan.
Right. And the key to a successful program, setting those SMART objectives.
SMART objectives. I've heard that term before, but I'm not entirely sure what it means.
It's pretty straightforward, actually. SMART stands for specific, measurable, achievable, relevant, and time-bound. They're objectives that give you a clear target to aim for.
Can you give an example?
Sure. Let's say your goal is to reduce the number of falls among seniors in a community. A SMART objective might be to increase the number of seniors participating in fall prevention programs by 20% within the next year.
So it's specific, you can measure it, it's realistic, it's connected to the overall goal, and it has a time frame.
You got it. That's a SMART objective in action. And once you have those objectives, you can start identifying the activities that will help you achieve them.
So these are the actual things you'll be doing, like workshops, awareness campaigns, policy changes, that kind of thing.
Exactly. And then comes the implementation phase, where you put all of that into action, making sure the community is involved every step of the way. It's all about communication, coordination, and making sure you have the resources you need.
This is a really comprehensive overview of the process so far. We've talked about defining community, assessing health, planning programs, and setting objectives. But how do you know if it's actually working? How do you measure success?
That's where evaluation comes in. It's all about measuring the effectiveness of your program and seeing if it's actually making a difference.
Okay, so it's like the feedback loop, the way to assess if you're on the right track.
Exactly. And there are two main types of evaluation, process and outcome.
Could you break this down for me?
Sure. Process evaluation is all about looking at how the program is being implemented. Are things running smoothly? Are you reaching the target audience? Are there any adjustments needed along the way?
So like checking your map to make sure you're still heading in the right direction.
Exactly. And then you have outcome evaluation, which is about looking at the results. Did the program actually achieve its objectives? Did it make a difference in the health issue you were trying to address?
Did you reach your destination?
Exactly. And evaluation is crucial for making sure that community health programs are effective and sustainable over the long term.
This has been an incredibly insightful deep dive so far.
It's a complex field, but hopefully we've given you a good foundation.
Absolutely. And before we move on to specific examples of programs in action, I have a question for you, the listener.
Ooh, good one.
Take a moment to think about your own community. What health concerns do you see? What strengths or resources do you think could be mobilized to address those concerns? We'll be back next week to delve deeper into those questions and explore how communities are making a difference. Welcome back to the Deep Dive.
Last week, we explored those core concepts of community health program planning in Canada. We talked about, defining community, that idea of community as partner, the different dimensions of community health, and even like the steps involved in assessment and planning.
Yeah, we covered a lot of ground.
We did.
Yeah.
But now I'm kind of curious to see how all of that plays out in a real world scenario. How does it actually work in practice? Well, the textbook actually uses this great example of a fall prevention program for older adults
Okay.
in Pine Ridge, which is this small, rural community.
Interesting.
And it really shows how those concepts we discussed can be put into action, to make a difference.
I'm really interested to hear more about this program. Fall prevention is such a crucial issue, especially as our population ages.
Yeah, for sure.
It affects so many people.
It does. And this case study shows how a community can really make a difference when they team up with healthcare professionals.
Awesome. So how did this fall prevention program actually come about? What were the initial steps they took?
Well, like most things in community health, it all started with an assessment.
Okay.
The community health nurse, or CHN, in Pine Ridge noticed that the number of falls among seniors in her community was actually higher than the provincial average.
Oh, wow.
Yeah, it was kind of alarming, and that kind of sparked her curiosity, so she decided to dig a little deeper.
So she had this observation, this initial spark, and then she went and got more information.
Exactly. She wanted to understand, how big is this problem really? What's causing it? And what do people in the community think about it? So she used a variety of methods to gather all that data.
Right.
She looked at stats from Statistics Canada, she had focus groups with older residents, and she even did one of those windshield surveys, remember?
Well, yeah, where she drives around and observes the community.
Yep, just to get a better sense of the environment.
That's awesome. It's a great example of all those different assessment methods we talked about last week.
Right. It shows how they can be used in a real-world situation.
Exactly. So what did she find out?
Well, she discovered that there weren't any educational programs on fall prevention for seniors in Pine Ridge.
Oh, wow. None at all.
Nope. And when she talked to folks in the community, they also brought up falls as a major concern. They wanted more info and support.
So there was a clear need, and the community was ready to address it.
Exactly, which is the perfect foundation for a program, right?
It is. So how did they go about actually planning the program?
Well, to guide the planning, the CHN used something called a program logic model,
Okay.
or PLM for short. Think of it like a roadmap.
Okay.
It helps you see the whole program from beginning to end.
I like that. A roadmap for change.
Yeah.
So how does this PLM work? Can you walk me through it?
Sure. It all starts with figuring out your inputs. These are the resources you need to make the program happen. Things like funding, staff, space, materials, even community partnerships.
So in this case, what were the inputs for the fall prevention program?
Well, the CHN was able to get some funding from the Provincial Ministry of Health.
Nice.
She also identified herself and an occupational therapist as the people who would lead the program.
Okay, so they had some expertise on board.
Yeah. And she also reached out to some other groups like the local senior center, home care agencies, even some clergy to help spread the word.
That's smart, getting the community involved right from the start.
Oh, totally. And that's one of the cool things about the PLM. It helps you think strategically about partnerships. It's not just about asking for help. It's about finding those who can really make the program better and who share your vision.
I like that. So you've got your inputs, your resources in place. What's next?
Then you move on to activities. These are the actual things you'll be doing to achieve the program's objectives. The actions, the things that'll actually make a difference.
So for this fall prevention program, what were some of their key activities?
Well, they had these educational sessions on fall prevention at the senior center.
Okay.
They covered things like home safety, exercises, managing medications. They also made flyers and posters with fall prevention tips.
Yeah, I've seen those.
Right. And they even did some radio ads to raise awareness in the community.
So they used multiple approaches to reach their audience.
Yep. And they also did something really cool. They recruited some of the older adults to be peer educators.
Oh, wow, I love that.
Yeah, it was really effective. It helped them get the message out, but it also empowered the seniors to take charge of their own health.
It's fantastic. It's about tapping into the community's wisdom and experience.
Yeah, exactly. And that's like a core principle of community health program planning, you know?
Yeah.
It's not about experts swooping in with all the answers. It's about working with the community, recognizing their strengths, and building on those.
I love that approach.
Yeah.
So we've talked about inputs and activities. What comes next on the PLM roadmap?
Next up are the outputs. These are the direct results of your activities, the tangible things you produced or achieved.
Can you give me some examples of outputs for the fall prevention program?
Sure. The number of people who came to those educational sessions, how many flyers they gave out, how many times those radio ads played, those are all output.
Okay, so it's about quantifying your efforts and seeing how far your activities are reaching.
Exactly. But at the end of the day, we're not just interested in outputs, right? We want to know what impact the program had on the issue itself.
Right, did it actually prevent falls?
Exactly. And that's where the PLM really shines. It helps you define those outcomes, both in the short term and the long term.
So for the fall prevention program, what were they hoping to see?
Well, in the short term, they wanted seniors to be more aware of ways to prevent falls.
Okay.
And then maybe make some changes around their homes to make them safer and just feel more confident in general about managing the risk of falling.
And were they able to achieve those goals?
Yeah, they were actually quite successful. They saw a big jump in knowledge about fall prevention among the seniors. Lots of folks made changes to their homes to reduce hazards. And the best part is they said they felt more confident about preventing falls, you know?
That's incredible. It's such a great example of how a well-planned program can really improve people's lives.
It is. And it shows how useful that PLM can be as a planning tool.
Yeah, it helps you think about the whole process, like from resources to activities to outcomes.
Exactly. And make sure that everything is connected.
I see how that would be helpful for anyone planning a community health program.
Oh, for sure. It's a great framework. Helps you stay focused on the goals.
So we've talked about the PLM. Are there other models out there for community health program planning?
Yeah, definitely. The textbook also mentions the precede-proceed model.
Okay, tell me about that one.
This model is a bit more complex, but it takes a wider view. It really stresses how important it is to understand all those social, environmental, and behavioral factors that influence health.
So it's not just about treating the symptoms, it's about getting to the root cause.
Exactly. And it's a 9-phase process, moving from planning to implementation and evaluation.
9 phases, that's a lot.
It is, but it's super thorough.
Okay, so walk me through it. How does this model work?
Okay, so the first 5 phases, they're called precede, and they all focus on assessing the problem.
What kind of assessment are we talking about here?
So the very first phase is social assessment. You look at the overall quality of life in the community, and figure out what social issues are impacting health. Then there's the epidemiological assessment, where you look at all that health data to understand the specific health problem you're tackling.
Okay.
And then there's the behavioral and environmental assessment, where you pinpoint those risk factors that are contributing to the problem.
Got it.
Then you have the educational and ecological assessment. This is where you look at the knowledge, attitudes, and beliefs that are influencing behavior.
Interesting.
And then lastly, you have the administrative and policy assessment, which looks at the policies and the organizational structures that impact the issue.
Wow, that's a very thorough assessment process. It seems like they're really trying to understand the problem from all sides.
Exactly. That's what makes the precede-proceed model so powerful. It makes you think holistically, consider all those contributing factors.
So once you've done all that assessment, what happens next?
Then you move into the proceed phases, which are all about putting the program into action and evaluating it.
Okay, so the first 5 phases are kind of like the diagnosis, and then these last 4 are the treatment and assessment of how the treatment is going.
That's a great way to put it. So the 6th phase is implementation, where you put your plan into action.
Okay.
Then comes process evaluation, where you check in on the program's progress and make tweaks if you need to.
Right, those mid-course corrections.
Exactly. And then there's impact evaluation, which is where you measure the program's impact on those behavioral and environmental factors you identified way back in the beginning.
Okay.
And lastly, there's outcome evaluation, where you're looking at the long-term effects of the program on the overall health of the community.
So it's a really comprehensive and systematic approach.
It is, and yeah, it might seem complicated, but it's super useful for tackling those really complex health issues. It encourages a deep understanding of the problem, a smart approach to intervention, and a commitment to continuous evaluation, which is so important.
I can see how valuable these two models would be for CHNs and anyone working in community health.
Absolutely. They provide a really solid framework for thinking about program planning in a structured way.
And something I want to stress again, community health isn't just the responsibility of those healthcare professionals.
No, for sure not.
It's a shared responsibility, everyone in the community.
Couldn't agree more. We all have a part to play.
Yeah, whether that's advocating for change, supporting local initiatives, or even just making healthy choices in our own lives.
Exactly. It's about working together, right, to make our communities healthier and happier.
Absolutely. And that's where we'll pick up next week, exploring all those different roles and responsibilities in community health initiatives. We'll be looking at the specific things individuals, organizations, and even government agencies can do to make a difference. It'll be great.
Welcome back to the deep dive. So we spent the last 2 weeks really digging into the fundamentals of community health program planning in Canada. We talked about that whole community as partner idea, the different dimensions of community health. We even explored those specific models like the PLM and the precede-proceed. Yeah, we covered a lot.
But, I'm thinking once you've done all that assessment, identified the health concerns, and chosen your approach, how do you actually put it all together? What are the actual steps to create and implement a program?
That's a great question. And thankfully, the textbook gives us a pretty clear roadmap for that.
Perfect, because I love a good roadmap.
Me too. And it all starts with really zeroing in on those specific patient concerns.
Now, hold on. Didn't we already talk about community health assessments?
Yeah, we did talk about those big picture assessments, but this step is about going deeper. It's about using all that information you gathered and really defining that specific health issue you're going to tackle. Think of it like, fine-tuning your focus.
Okay, so it's about going from the general to the specific.
Exactly. So let's say you're working in a community where the assessment showed a high rate of childhood obesity, right? Now you got to dig deeper and figure out what's really driving that in this community. Is it access to healthy food or safe places to play or maybe cultural norms around food? It could be so many things.
So it's about understanding the problem in context.
Exactly. You don't want to make assumptions. Once you've got that health concern nailed down, you can move on to the next step, which is figuring out those program goals and objectives.
Goals and objectives, that's where the rubber meets the road.
Totally. And remember how we talked about those SMART objectives?
Yeah, they were pretty important.
They're crucial for making sure a program is ambitious, but also actually doable.
Can you remind us what SMART stands for again?
Of course. Specific, measurable, achievable, relevant, and time-bound.
Okay, I remember now.
Okay.
So, thinking about that childhood obesity example, what would a SMART objective look like for that?
Okay, so a big goal might be to reduce the overall rate of childhood obesity in the community.
Okay.
But to make that happen, you got to break it down. One objective might be to increase the availability of fresh fruits and veggies in local stores, say by 15% within the next year.
Okay.
Or maybe you aim to create 2 new playgrounds in neighborhoods that need them within the next 2 years.
So you're taking that big goal and making it into smaller, concrete steps.
Exactly. It's a roadmap, but it's got to be realistic too. And the next step is where it gets even more hands-on, planning for implementation.
Okay. What do we need to think about here?
This is where you flesh out the details, like what resources will we need? What are the specific activities? How much will it cost? What's the timeline? It's basically taking those SMART objectives and turning them into a detailed game plan.
I bet this part can get pretty complicated.
Oh, it can be. That's why you got to bring the community in.
Right, that whole community as partner idea.
Exactly. They're the experts on their own needs. They can tell you what'll work, what won't. Plus, it makes people more invested in the program's success.
That makes a lot of sense. So you've got your plan, the community's involved. What's next?
Now you got to look at your options. You might have a few different ways to achieve those objectives.
Right, different paths to the same goal.
Exactly. Now you got to analyze each one. Think about the costs, the benefits, will the community be on board? It's about making good decisions, not just jumping into something.
So careful consideration is key here.
Definitely. And sometimes the best solution is a mix of different approaches. You got to find what fits the community best.
I like that. It's about being adaptable.
Exactly. And once you've looked at everything, you choose the best solution.
The big decision.
But remember, it's still a group effort. Got to make sure the community supports the plan.
This has been so helpful in understanding how to create a program.
We've covered a lot.
But before we wrap up, I want to talk about one more thing. Evaluation. We haven't really dug into that yet.
Oh, evaluation is so important. It's how we know if the program is actually working, if it's making a difference.
Right, but some people might think of evaluation as something you do at the very end. Is that the right way to approach it?
Not really. It shouldn't be an afterthought. Evaluation needs to be part of every step.
So it's ongoing.
Exactly. You got to keep an eye on things, collect data, make adjustments as you go. That includes both process evaluation, which looks at how you're running the program, and outcome evaluation, which is all about measuring the impact on the actual health issue.
So it's like a feedback loop, making sure you're on track.
Exactly. Plus, it helps show funders that their money is being well spent.
That's a good point. Well, I think we've covered a lot of ground in this deep dive.
We have, from the basics to the nitty-gritty.
From those big ideas about community health to the practical steps of planning and implementing a program.
Hopefully our listeners feel ready to take what they've learned and make a difference.
I hope so too. And remember, community health is everyone's responsibility. Whether you're a healthcare pro, a community leader, or just someone who cares, you have a role to play in building healthier, more vibrant communities.
Absolutely. It's a team effort.
And that's a wrap for our deep dive into community health program planning in Canada. Join us next week for another exciting topic.